Welcome back. I'm going to invite you to take your seats so that we can get started with our next session. So as a follow-up to Dr. Guadagnoli's excellent presentation, our next speaker is going to take you through the steps that you can take to assist you with going through this process. Tina Soares is the director of Cape Cod Healthcare's Quality of Life Initiative. She has had a long-standing career in nursing, including both the Cape Cod Hospital setting and the VNA service. Tina is a certified hospice and palliative care nurse and has been an integral leader in the advanced care planning for Cape Cod Healthcare. You can, as Tina speaks, you will see how much passionate she is and how much thought and work she has put into this in helping people understand the concept of the advanced directives for their care at any age. And so without further ado, Tina Soares.
Yeah. Great, thank you. So one thing I've learned doing this work is we all have a story, right? I moved back to Cape Cod 10 years ago now, and I moved home, being the baby of my family. I never thought my parents were going to get old. Oops, sorry. And after being gone for 22 years, oh, by the way, my first career as a park ranger. I had a calling later in my late 20s, early 30s to become a nurse because I do get passionate about certain things, and I had that calling to go to nursing school because I wanted to do more. And I'm so glad I came home when I did because Mom was diagnosed with Alzheimer's and my dad had already been living with Parkinson's disease for 2 years. So when I moved home, I saw quite a different picture being here every day. A different picture other than dropping in for the 4th of July for a week visit, spending time with my family, and being with them on a daily basis. I said, wow, my mom and dad are aging. Things are looking different. I'm really happy I'm home, not only to share some quality time with them, but to help them manage. Healthcare system is very complicated. And even as a nurse, I'll share some other stories with you as we go. It's not easy, and it's not easy when it's your own parent. Because a lot of us think, oh, nothing will ever happen to mom and dad. But when it does happen, that's when you wish you had had the conversation. So I'm going to introduce to you a video that really speaks to volumes about the work that we're doing. And we're going to take a look at that right now.
And finally tonight, ABC News wants to join you in something right at the heart of the American family. How we can all help the people who care about us make decisions near the end of our lives. And 9 out of 10 of you have told us that we should all be talking about it at all ages, what we want. And yet only a fraction of us have done it. And we know it makes a huge difference in the health of the caregiver as well as those cared for. So ABC News has taken cameras inside a vital, loving family, part of a new community, deciding to have the conversation.
This is 85-year-old Norb and his daughter Maureen.
My dad is 85 today. He's still very, very active. He's a wonderful friend.
Throughout life, daughter and father have always talked about everything, except one thing: how to control the end of your life in the same way you control the prime of your life. So dad and daughter gather the family together, 3 generations, for an act of love.
And so now we're just asking that you share some of your thoughts about what you would like at the end of your life, so that we can honor your wishes.
They are part of something new underway for families in America that says having the conversation is a gift parents and children give each other. And there's proof of the difference it makes. Studies show depression rates plummet after a loss if the families have had the conversation. Renowned physician Dr. Atul Gawande says doctors and nurses see it firsthand.
When you're there in that moment and you're talking to the family and you're saying, how much will it bother your father if he ends up this way? And they say, more often than not, I don't know. We never talked about it. That it is incredibly traumatic for the family, for the doctors involved. There's often conflict. It can tear families apart.
So Dr. Gwande has become part of a team led by Pulitzer Prize-winning writer Ellen Goodman. It is called the Conversation Project. It is a kind of guide for families looking for a way to begin.
If we give them a way to talk about it and give people something to hang on to when they're afraid to start this conversation, they can do it and pass it on.
Families like the Jennings. They looked over the conversation guide before they sat down together. First, there's laughter.
My golf swing's still good.
And then Dad directly eases his daughter's guilt and worry about having put their mother in hospice.
I felt like that meant we were giving up on Mom.
She was in a lot of pain, and I think it was handled real well.
And next, Maureen asks her dad for clarity on what he considers a good end to a great life.
So if you were in a condition where you couldn't make decisions for yourself, how extreme would you want us to take measures to save your life versus letting you go?
Well, I think I'm ready to go anytime. You know, I wouldn't prolong anything. I mean, I've lived a great life. Pretty lucky. And because of you guys, you know. And
Unexpectedly, a grandson is inspired to speak up about his own wishes for his own life.
That if there was no meaningful communication, that I would want you to stop trying to intervene.
we aren't ready for you to go that soon.
Well, we're not ready for you to go that soon either, so.
And one by one, the others weigh in, all ages.
Don't do that.
Happy birthday, dear Grandma.
And with that, another family has joined a kind of estate planning for the heart.
Go!
The conversation beginning in America.
So please tell us your stories in the days ahead about ways to begin the conversation with family members of all ages. Or if you don't want to have it, tell us about that too. My colleague and my friend, anchor Bill Ritter from WABC, and I will be reading your emails and looking at the great photos you're already sending us of your families. So go to abcnews.com, find the conversation and the guide, and we'll be seeing you right there.
So instead of sending Diane Sawyer those emails, please send them to me. Because this was filmed quite a while ago. But so what is it that's not working? What is it that we find complicated? What are some of those barriers? We did a lot of research over the last couple years, and we talked about being passionate. And I was often a nurse called to the bedside. And I got to a point and I said, why am I having the conversation with this patient and family instead of the family having the conversation or having it ahead of time with their physician? Because I know that some of the patients I took care of didn't want what was happening to them, and they didn't want to end their life in the hospital. Having gone through it with my own parents and their experiences, they both were quite different. So what I wanted to do is put that time and effort into research to say, okay, what's going to work? And I spent a couple years really looking at other programs to say, how do we make this work? What is this magic bullet? How are we going to get this done? Well, one, Dr. Guadagnoli said, we're going to do this in the community. This isn't going to start in the walls of the hospital. This has to start before a crisis happens, before a medical crisis happened. And that is true. But what are some of those other components that aren't working? You know, Dr. Guadagnoli showed you a slide that 78% of the patients that I had questionnaire coming into primary care practice and those other practices, 78% thought they had a healthcare proxy on file, but they didn't. So what does that mean? What was that showing us? So we went back and asked a few more questions. I think people are very confused about the language we use in the state of Massachusetts. Advanced directive, healthcare proxy, surrogate. A lot of language out there. The other part was, why are we not connecting with our physicians? Why aren't we having this conversation? You just had another exacerbation, or you just went into the hospital with your heart failure, yet in your follow-up visit with your primary care doctor, what are you asking them? What is your current understanding of where you are in your diagnosis? what can you expect next? So that's why we came up with these core components, or I call them our pillars. And this is what is going to make it work for you. This is how we're going to honor your choices throughout your life, not just at end of life, but now. If you encountered a medical crisis right now, this is what we need to do. So the first part is thinking about what's important to you, what matters most. You know, it's kind of starting the conversation, but you need to think about it for yourself as well. The second part is communicating those choices. This is kind of the planning document piece. How many of you already have a completed healthcare proxy? Great. Have one. Maybe a living will? Yeah. And where is it? Have you shared it with your doctor? Have you had a conversation with your doctor about what matters most to you? Yeah. So some of you have. But here's what typically we find. The healthcare proxy document and that living will or any kind of plan that you may have written out is typically in a safe deposit box somewhere. In that folder that you told your son, if something ever happens to me, go to this folder in my file cabinet and you'll find everything you need. But unfortunately, that doesn't help us because usually that's too late. So we're not making that connecting piece, that last piece, having the conversation with your care providers, family members that's ongoing, and making sure that your planning documents that I'm going to talk about are in place in the event that you did come into the emergency room or you were admitted to the hospital. We would have a guide. We would have a place to start. I do have a funny story that I'm going to share because my dad used to see Dr. Siddhartha. And very often when we go into the doctor's office, I would go in with Dad. And my dad was, well, he would have been in his 80s. Both my parents have passed. They passed 4 months apart from each other. Mom first with her Alzheimer's, and then my father. But my dad, as we were going, connecting that piece, okay, Dad, we're going to the doctor. He needs to know what's going on, where you are. And very often my dad, like other older gentlemen or ladies in their mid to late 80s, want to make sure their doctor are proud of them. So my dad would go in to the doctor, and we would sit down, and he'd be like, how are we doing, Jim? And my dad would be like, great. How are things going? Fine. And I'm standing behind him going, yeah. And my dad had Parkinson's, so he was having more and more harder time getting around. And Dr. Sid was like, how's your balance, Jim? Any falls? Oh, maybe just one. He had 6 in 1 week. One day I had to pull him out of the bushes because he thought he could get out and do some trimming and ended up in the shrubs, and I had to pull him out. But, that's the stuff that he didn't want to share, but those were indicators that his function was declining, that his health was declining. So that's why it's important to make sure that you're communicating with your physicians as well, because they don't know what happens at home. They get a very small snapshot in the doctor's office, right? And very often we try to let them think that we're doing great. Nothing's wrong with me. But it's okay to have that conversation. The conversation starts with you. This can't start really anywhere else. This is about you. So what matters most to me? If I had a medical event, and I'm not talking about end of life, I'm talking about now, and I were unable to communicate with my family or even my physician, what would I want them to know? Oh, this isn't moving. Oh, okay. So I'm just going to take a moment and ask you, you have a couple tools that I provided for you. One of them Dr. Guadagnoli showed you already, but I also want you to take this handout out, this one right here. At the top it says the Conversation Project, Conversation Starter Kit Summary. And what we found in our research, kind of starting with the basics, is again, what's most important to me? What concerns or worries do I have, now or in the future? Do you know what your current state of health is, and do you have additional questions for your physician that you might want to ask? And who are those people I need to share this information with? And, could be family, could be a faith leader, could be your buddy, could be, a neighbor, as long as the neighbor is close to you and they know what matters most to you. And then when are we going to have the opportunity to talk? So On this worksheet, we're just going to take a minute, and then even if you've already done planning or had a conversation, or maybe haven't started a conversation, we're just going to take a minute. You're going to keep this personal. This is for you to take home. When should you have the conversation? We're going to talk about that. But I want you to kind of go through this and think about ending this sentence. What's most important to you? And what matters to me now or matters to me to end of life? And there's a couple scales there that you can complete. But the most important part I want you to finish, I'm going to give you about 5-6 minutes to do this. What do you feel are the 3 most important things you want your friends, family, doctors to understand about your wishes or preferences, not only for your care, but also end-of-life care? So just take a few minutes looking this over, and you'll get a feel of why we're doing this, okay? And I'm making Dr. Guadagnoli and Dr. Siddhartha do it as well. Just so you know, I make all my task force members do all this. We do all the planning. They're like, oh no, more homework. Just make sure you get those in.
Could you speak a bit louder? It's very hard to hear.
Sure.
There you go. No, try it now. Say something.
Is this better? Okay. I am soft-spoken. Although my dad would have told you different. Okay, it looks like most of you have jotted down some thoughts. And again, this is just an exercise. We do this in some of our workshops because even if you have done your planning, it lets you kind of rethink, how do I start this conversation if you haven't had it yet? You know, thinking about what you need to share. And sometimes it's not easy. Does anybody want to share any thoughts, kind of filling out some of these questions? Do they feel uncomfortable, or was it easy? Was it helpful? I find that sometimes the barrier is my son or daughter don't want to talk to me about this. They think that, you know, we can talk about it later. We don't need to talk about this now. I'll share a quick story that, you know, these were some of the similar questions I had to ask my dad. We didn't get to have the conversation with my mom. It was too late by her Alzheimer's advanced. And then she started to quickly decline. Unfortunately, at the same time, my dad was also dealing with his chronic disease. And after Mom passed, I actually used some of these questions. We started the discussion. You know, my dad was two-time combat, two times in Korea, 2 tours in Korea, Purple Heart, you know, tough old Marine. Didn't need to talk about these things. He was kind of kept them to himself. But he saw what we went through with Mom. So we did start to have this conversation, and we started to use some of these questions and some of the questions you went through, because guess what? I would not have known some of the things I needed to know for Dad through his end of life, and we would have been left in the same turmoil as we did with Mom. I have 3 other siblings. Didn't go so well at end of life for Mom. We all had our own opinion, what Mom would have wanted. We came together in the end, but it was very stressful. Very stressful. But the part with Dad was the hardest because, unfortunately, Dad was burdened with knowing what Mom would have wanted. And he did pass away asking me all the time, do you think we did the right thing for Mom? You know, he went to his grave not knowing if how we cared for Mom at the end was what she wanted. And it was very tough. That was tough for me to witness. But asking some of these questions really turned it around. And if I can do it with my dad, you guys can do it. Because Dad didn't want to share anything. But he opened up. You know, it was a simple question, what matters to me? You know, if you needed to write some thoughts down, those top 3 things that you want your family to know, your care provider to know, friends and family to know, what would those top 3 things be? For someone like my dad, it was maintaining his independence, staying home, and being comfortable. You know, you can elaborate on that, which is very easy. In this toolkit that I provided for you, the yellow one, it's also in your bag. You can go through that a little more in depth. But sometimes we think we have the conversation with our children. I was asked to come down to Chatham to speak to a family after Dr. Guadagnolo and I presented. And they had everything done. They had a living will, they had a trust, they had their healthcare proxies. They already purchased where they were going to next in senior living. But after our presentation of something similar to this, they were really upset. They're like, can you come to our house and talk to us? And I said, well, this is great, because this was in the beginning, and I'm used to talking to people who are in crisis. I get to go talk to someone not in crisis. This was great for me. I've never really get to experience that. So to test it out, one of the first things I said to them was, so have you had the conversation about what matters? You know, they say, oh, we've done this and that and this and that, but no, we haven't had the conversation. Great. Well, let's start. And I gave them a toolkit, and we went through it. And they're like, this is great. We're going to be able to start a conversation now with each other. Like, okay, well, but that's not where it needs to end. I said, do you have children? They said, yes, we do. They have a son in England and a daughter who lives local. So we talked about that. And we talked about why it was so important for them to start this discussion with their family members. Because lo and behold, what we see all the time is the son or daughter from California will fly in at the last minute, be at the bedside and say, do everything you can for Mom. And they said to me, oh, that's our son. And I said, well, okay, well, when's he coming home next? And they said, he'll be here for Thanksgiving. I said, you're going to take this out, and you're going to talk about it. So for them, it made another layer, so to say, of honoring their choices, not just the document, but having the conversation. And that's what's really important for us. Oh, some of the icebreakers. You can probably say, well, this was difficult, but I'm not ready to have the conversation, and I don't really know how to introduce it. So you do have some of these icebreakers in your toolkit as well. You can even blame it on me. You say, I went to a presentation today, and this nurse said I have to do this. You know, that's okay, you can do that. But really looking at some of the questions, especially with Dad, like, I need to talk about your futures to help me. I used to have to do that all the time. I say, Dad, we need to talk about these things because it's going to help me. Because one of the first things he said was, I don't want to be a burden on you. Well, you're going to be a burden unless we can have that conversation. You know, sometimes I'd have to force him into it. So I used to have to turn around, help me help you, and you'll help me. So there are ways to introduce the conversation to make it less uncomfortable. We should have these conversations, anyone over the age of 18. My children are tired of me talking to them about what my wishes are, but that's okay, because we need to do this before a medical crisis. You know, even at milestones, those birthdays, you know, 30, 40, 50, 60, 70, it's not just one conversation, you have to continue the conversation. Major life events, someone going to college, you're getting married. My daughter's getting married this summer, and she's already told me she's going to have her fiance be her person that can speak on her behalf, and she started to have the conversation with him. And she's only, you know, she's in her 20s, and I thought that was great. Divorce, moves. We even found healthcare proxies in our charts where, you know, the spouse had already passed or their friend had moved. You know, so that's why we have to keep these conversations going. And then any new diagnosis or an illness or an event. So a new diagnosis comes along. This is a great opportunity not only to talk to your care provider, but re-engage the conversation with who needs to know within your family or friends. I provided these tools because they are helpful, and each of you have one in your bags to take home and go through. Because the second part, after you think about what matters most, now what? How do you put some of these things in writing? A living will is great, but I'm also going to introduce you to something else. But putting these choices in writing in a crisis event, if you do have something in writing and you do have the person that's going to speak on your behalf, that's great because it gives them a guide. It's a plan. You know, in a crisis, you can say, remember this, and they can pick it up and take it from there. So it's very helpful. It's going to be your roadmap, not only where you are now, but now to end of life. And that roadmap helps us as clinical providers in all the care settings, primary care practices, specialty practices, into the hospital, because we want to make sure that you get the care that you want. So again, what's that next step? In this toolkit that I provided, this is kind of the first steps. After you've had the conversation and you've thought about what matters most, where do we begin? How do you begin to put that plan together? You pick the person who's going to honor your choices. You know, with my dad, I felt very bad for him because maybe he shouldn't have been mom's healthcare agent. Maybe at that point it should have been one of the other children because he felt burdened because he was never able to have that conversation. So making decisions for him was very difficult. So it can change at any time. This agent is your advocate, the trusted person that would talk to your healthcare providers in the event you couldn't speak for yourself. This person does not speak for you until a physician signs a medical order saying, this patient, I need to speak to their agent now. And again, it might be temporary, but not only do they speak for you, they may have to make decisions. So making sure you have the right person that's able to honor your choices. We did have a patient that the spouse did not want to honor her choices. You know, he wanted everything done, and she did not want everything done. So maybe he should not have been the person to speak on her behalf if she couldn't speak for herself. The agent has a legal power to step in and speak on your behalf, but you gain reconsciousness or you're deemed able to make your own decisions, that person has to step back. This is just a temporary appointment, so to say. So this person doesn't speak on your behalf all the time, only when a physician deems that you are not able to speak for yourself. And who should you choose? Again, think about that. Could be a community, it could be a friend. Don't choose a neighbor who doesn't know you. Could be a child, doesn't have to be the first one in the family, doesn't have to be the oldest brother, like in my family. So you really need to think about that. And then you can also make sure that you talk to them and give them your parameters. You know, if you don't want your agent to make certain decisions, great. They don't. We just need to make sure it's in writing. So I've given each of you an actual healthcare proxy document. It might be familiar to you, especially those who have already completed one. But this is the actual legal document, becomes a legal document after you have completed it, and you have 2 witnesses sign. As Dr. Guadagnoli said, he had to wait for 2 of his friend's daughters to come over. But this is your actual legal advance directive in the state of Massachusetts. This is it, just this one. This is why it's so important for us in healthcare, because if you can't speak for yourself, we need to make sure you're honoring your choices, and this is the person you're appointing, or persons. At the bottom of this document, you might see this is new. And a lot of our workshops that we do out in the community, once we walk through the toolkit, we say, even if you've already chosen an agent, you may have changed your mind now. Or maybe you haven't. You want this person to continue to be your agent. But after you have the conversation and they understand what their role might be, have them sign the bottom, that they understand they're accepting this role. Because too often, you may have been given this document either in a doctor's office or coming into the hospital, and they say, here, complete this and just give it back to me before you leave. But do you really understand what that means? Do they understand what that means? And that's why the education is so important. In the event of life changes, circumstances like divorce, death, you really need to make sure that the document is updated. In the case of a divorce, that document will become null and void. You can still have your ex-spouse as your agent, just need to complete a new document. But just so you know, life events, that should be a trigger for you to say, oh, my planning needs to be updated. The personal directive or living will is in the back of the toolkit. Very often, we have had living wills come into our medical record, but they don't always explain everything. You know, really that conversation is really where we get our information from. The personal directive or living will, it's a great guide. It's a great conversation starter. You can use it, share it, please do. But what we want to know is in the personal directive or living will, you know, it walks you through some great choices. But one thing is when it comes into the medical record in black and white, we don't know if maybe mom or dad would have wanted to try to do this new experimental treatment for maybe 2 weeks. And if it didn't work then, would that help? You know, very often in oncology patients, there's not black and white answers. But if you have that core conversation about what matters most to you, typically the agent can walk that through with the physician and say, you know what, if mom's going to have all these side symptoms and she's not going to be feeling well and she's not going to recover from this, we're not going to try it. You know, it's not what she would have wanted. So questions like that. This is a great guide. And again, the personal directive at the back of the toolkit I gave you is a good conversation starter. The connecting piece. If we don't have the conversation, as Dr. Guadagnoli had mentioned, and Dr. Siddhartha, the conversation is so vital, especially with your care providers. If you don't have a good current understanding of where you are in your state of health and where it's going to go, it can be very difficult. You know, working with my dad, luckily I was a nurse, and I knew what Parkinson's disease was going to do for him, or undo for him. He was really going to lose his mobility. Eventually he might have trouble with some other, areas. But the most important thing to him was walking. So when we went to the physician, we would want to talk about, okay, Dad, how can we keep this going? Do you know this could be the outcome? And we did. We started planning in the house, like, if Dad's in a wheelchair, are we going to be able to keep him home? Are we going to be able to use a ramp? Are we going to get him through the doorways? Lots of things like that had to be discussed ahead of time. And if you don't ask the questions, you don't know. You don't want to be left in crisis. The same thing with a heart failure or another condition. You want to know what to expect, what's coming ahead. And then the medical record component. Dr. Guadagnoli made it very clear that our medical records don't talk to each other. My recommendation is that you keep a copy of your healthcare proxy document on your person, or you keep it in your glove box. You make sure that your family members all have a copy of it until we get to that day and we can retrieve it from cyberspace and say, oh, here it is, we all have it. But we're not there yet. So the best thing to do is make sure that you have a copy on you and make sure it's up to date. Talking to your care providers, I know that Dr. Siddhartha gave you the Ask Me 3. That's a great guide for someone starting to manage maybe a chronic illness, having more difficulty. You also have how to start a discussion with your care providers. What's ahead of me? What else do I need to know about my illness? If I wasn't at all those visits with my dad asking the questions, it was very difficult for him to manage. He had 6 different care providers. He had a cardiologist, a pain specialist, a VA doctor. He had Dr. Siddhartha. He had a neurologist in Boston. He had some home care we finally talked him into because he knew that was going to benefit him. So how do you start that discussion to make sure everybody's on the same page? You have to, unfortunately. Your family members have to. Your agent has to, in case you can't speak on your behalf. So that's why it's important to be prepared. So in best practice, what we found for us is making sure you have an appropriate healthcare proxy document and an agent appointed. You have the discussion so everybody's on the same page, and you can put some of that in writing in this personal directive or a living will. The last piece is just to remind you that all these documents that we talked about can go into your medical record. And if we don't have it, it's very difficult to work from there. And again, if the whole family's on the same page and everything's going well, that's great. But typically at a time of crisis, it's very stressful. And it's good for us to know that you've had a conversation. So I'm asking you to leave in action. I gave you some homework. My task force members have homework, you have homework. And I gave you a checklist, kind of asking you what to do. Making sure that you use these tools to have the conversation if you haven't already. You can simplify it. Just start that. Start the ball rolling. Review any planning you may have done. I'm telling you, we found documents coming into medical records that were either invalid, the agent no longer was either in the area or we couldn't contact them, or now they had dementia, or now they're a strange relationship and it's not the same person. We want to make sure that your healthcare proxy is shared with your physicians, especially the hospitals, and your loved ones, so that they all have a copy. And keep the conversation going. This isn't just one document, one conversation. This is something that is ongoing, and it does get more comfortable as time goes on. One of our task force members is a retired physician in Chatham, and he's been on the task force for quite a while, retired oncologist. And he comes to meetings and he has great input. And I finally asked him one day, I said, have you done this planning? Have you had the conversation? And he said, not yet. So at Christmas time this year, he actually got all of his children together, because they're older and he's got grandchildren in college. And he said, I finally did it. He came back to me and I said, I finally did it. He said, after 2 bottles of wine, much arguing, crying, and then laughing, he said it's actually probably one of the best times we had with the family. Not only were his children present, but his grandchildren, his wife. And he said it was one of the best experiences he's ever had. Now that he has gotten older, he said, I actually don't feel burdened anymore. He said, I actually feel that, you know what, no matter what happens to me, this is going to go well. So it can happen, and that's what I want all for you. We want to respect your choices for care now, right now, even me. I want my choices respected through the end of life, you know, because there's a 100% mortality rate in this country. It's all going to happen, right? That's the statistics they tell me. So that's why our gift to you is to please start the conversation. It is a gift. It's a gift you give to your family. It's a gift I had with my dad. And it's a gift that I have with patients and other families. So please keep that rolling and share it with your friends to say, you need to do this too. And that's how it's going to work. So any questions?
Thanks. On the mechanics of the proxy, if you designate a primary and an alternate, it's the same mechanism. If the primary is not able to make a decision, then the doctor make a decision to use an alternate. Is that how that works?
That's correct.
Okay.
And you can have more than two. But here's my words.
Can you repeat the question?
Oh. So the question was, you have a primary, typically a primary and alternate on the healthcare proxy document, even if you drew it up with your attorney. You can have more. But his question was, if the primary wasn't available, yes, we go to the secondary. We would keep going. My words of advice are, we've had families in the hospital. We had a primary, secondary, a tertiary, and they weren't on the same page. And that makes it so difficult, you know, especially when you're dealing with a very distressing situation to begin with. They didn't have the conversation with their kids. My second word of advice is, if you, I have a second marriage, so my husband and I both have kids. We've been in situations, Dr. Guadagnoli and I, where second marriage comes into play, and they both had older children. And they weren't necessarily happy that the new spouse was appointed as the agent. You know, again, conversations ahead of time can relieve, and actually the planning document, doing the personal directive, can take away some of that questioning at the time of a crisis as well. So that's one of my words of advice, especially with the healthcare proxy document.
I'm in Costa Rica. I'm fall off the zip line. I land in the hospital. How do these documents work? How does the hospital get my medical records? What happens?
In Costa Rica?
Yeah.
Have no idea.
Or France or somewhere else.
Here's I would get a great answer for you. Okay, just so you know, every state, these documents are not portable, which means if you live in Florida and you're here half the year and you're in Florida half the year, we ask that you please get the documents provided in both of those states, because technically, Massachusetts does not recognize out-of-state documents. Like the healthcare proxy, that's the only one we're talking about, right? I have had families that do the planning, but then they'll also put it on a flash drive. So wherever they go and travel, they have it with them, or they put it in cyberspace. There are, well, medical records, if you're out of the country, I would have, like, I know that Physcians, Emerald Physicians does it. You get a copy of your last visit. You know, so if there's something pertinent, there are nice little documents to fill out. Here are my medications. This is my current medical condition. If all of you are Emerald Physician patients, you get a copy of that last visit with all that information, which is phenomenal. And you can scan that into a folder. You can also, there are apps out there on your iPhone, that little heart. You can put this pertinent medical information on that as well. There's so much technology, so what I'm saying is you have control of putting your information into a platform that you can take with you. I'm just letting you know that in the state of Massachusetts, if someone came from Arizona and something happened, of course we're going to do everything we can. But if you just moved here and your children in a state of distress, we really want to, make sure that we have the proper documentation on file in the state of Massachusetts. There's a lot of great technology apps out there to put your medical information on.
Thank you. I did wonder if you could share with us how important it is in this day and age to have your healthcare proxy be geographically nearby versus not so much in case you have a preference for someone who isn't?
Excellent question. Here's my story. I had a patient at Cape Cod Hospital, both the son and the daughter. She had 2 kids. The son she appointed geographically lived in Cape Cod. He was probably not the most appropriate person. She should have had her daughter in California. So we will call the agent and have conversations. They don't have to live local, so family members can be out of state. They could really, and if they have that information we need, I really wish that daughter from California was the healthcare agent in this place, in my situation, because the son said, I don't want anything to do with this. So geographically, don't just pick someone who, is right next door that can take you somewhere. Pick whoever's going to be most appropriate to speak on your behalf.
Wouldn't Medic Alert be a logical place to have the healthcare proxy? It's a well-established, well-known national organization and
Excellent.
accessible by emergency and, I don't know, physicians.
I'm going to tell you this, that's an excellent idea. What you can do is, and my dad did this because I was my dad's agent. My dad had when he fell and he was in the bushes, they called me. I was his agent. So you can appoint that through whatever service you use, Medical Alert, one of the local alarm systems. If you have one of the alarm companies, you just make sure that they know who your agent is, because that's who's going to be called as well and informed. So right now it's up to you to inform that company who it is and who you want them to reach out to. And they'll do it. They'll add a couple of numbers. 911. My dad had specific instructions, call me first and then 911. So that's what you can do. They won't keep it on file. There's so many different companies. I don't think they keep anything on file per se, but they might. I know one of our local companies probably would, but just make sure they have that number.
Folks are filling out the
Yep.
newsletter, email form. Do you want to say anything about it? And
I would love to. So anyone who has any additional questions that you didn't want to ask or you're thinking about and you want me to respond personally or Dr. Guadagnoli, we're more than happy to. I also have a great new newsletter that's coming out as part of our task force initiative that's going to share some great practices. Institute for Healthcare Improvement and the Conversation Project just shared a beautiful article about Barbara Bush. And, we'll also talk about some of our events in the community, some of our coffee and conversation groups, some of the workshops. So on that newsletter, you get all that information.
And if you're filling it out, if you're filling out your email address and name, you can just leave that sheet on the table and we'll collect it and get it to Tina. Thank you.
Great. Oh, one more question. The wellness trails? Yes. When is the next wellness trail?
Yeah. Let's give a round of applause for Tina for that excellent presentation. So thank you so much for your attendance and making use of this information. So talk to your primary care doctor, talk to your family members, get the conversation started. It's so important. I would like to just give a couple of pointers. One is there will be a survey that will go out by email to your email address. Please fill out the survey because we depend on your feedback to understand how we can make this better, these educational programs better for you. Over the past, since 2017, we have listened to your input on these surveys, and we have co-designed this program for this year. So it is, it helps us to know where your priorities are, what matters to you, to use the same phrase, so that we can design these education programs, we can select the topics and themes around your needs. So please fill out those forms, the survey form. And our next topic is on joint health and arthritis, back pain, hip, knee pain, and looking at the totality of how to address those concerns, including nutritional aspects of how to prevent or delay the degeneration. We'll have a rehab specialist come and talk about how can you maintain function or reclaim the joint function after you develop arthritis. We'll have a neurosurgeon, Dr. Paul Hool, will speak about spine health and being active when you develop spine issues. And we'll have an orthopedic doctor, Dr. Wilsterman, also talk about knee and hip joint issues and some of the advanced surgical techniques they have now if your joints reach a point where they need repair or replacement. So our next event, that orthopedic topic, the joint health topic, is in a different location. It's not here. It's in Seacrest Beach Hotel in North Falmouth. That is on May 6th, which is coming around very soon, Sunday, May 6th, and you'll get an email about that as well, right? Yeah. Okay. All right, well, thank you very much. Go and enjoy and get some sun out there.